Dr. Adravanti, how long have you been working in the orthopedic field, and why did you choose to become an orthopedic surgeon?
Maybe is related to the interest in the sport activity. So at the beginning of my career, I was a sports medicine surgeon, and after I changed a little bit to a niche knee arthroplastic surgeon. I think that is related probably to my motivation to the sport activity.
How has orthopedics changed over the course of your career?
The main words that determine the philosophy of the Lima company are emotion, and I believe that's very important for the patient, of course. Lima company supports a lot during the time my activity. I think that starting from 2013, with the idea to create a new design for knee replacement, and I'm involved in this project. I was involved in this project. The philosophy and Lima company was the same of my philosophy, because I believe a lot in restoring the emotion for the patient.
At LimaCorporate, we're driven to restore the emotion of motion for patients. How is LimaCorporate supporting you in this mission?
In my country, the first question is related to the physiotherapy and not operation, and not the problem and the risk related to the operation.
What about surgeons? We know that you have implanted a LimaCorporate knee prosthesis in another surgeon. Why did you choose a uni?
So I think it's a very good indication to do a uni, because uni is the most important knee replacement for doing more activity after the operation. We have a good indication for uni. I think that probably is the best operation for the patient, especially for the young active patient.
And why Physicadzuk?
Most important reason is related to the survivorship of this implant, that is the best survivorship in every type of register, and also because I'm very familiar with this implant, so I'm very confident.
Is then a surgeon a good patient? Which are the questions you have received before and after the surgery?
Is related to if my opinion is the same of my colleague to do a uni, but after we have decided together that is the right solution, you have no question before and no question after the surgery.
Which are the expectations for a patient following UKA? Do you see your patients returning to sports or activities they loved?
Yes, of course, the patient, this depends on the patient. They can do bike, they can swim, they can walk, of course, they can do some activity like tennis or skiing, but not with continuity. So the answer is that can do some activity. Of course, they can't do activity in which is involved in twisting or something like that.
Have you seen the expectations of your patient change in the last 10 years? Do they have higher expectations than before?
Yes, I think so. Probably yes, but probably change the mentality and change the approach to the operation. Not the expectation. The expectations remain the same.
What does emotion of motion mean to you?
The emotion of motion mean to me is restoring the motion of the knee and restoring the sensation to have to change the quality of the life.